Good morning, Governor Wolf, Director Collins, Director Padfield, PEMA Director Padfield. My name is Mark Zimmerman. I'm the CEO of Americhem. I want to do a few introductions first. First one is I want to introduce the founding partner, past CEO, my mentor and my father, Bill Zimmerman. We started this business 30 some years ago out of my sister's bedroom when she went down to Florida. And we had a thermal fax machine. My mom would have her typewriter, and we'd have a little garage out back. We put some chemicals in, and that's how this business started. And actually, it started on the backs of the AIDS crisis, so it kind of brings back some memories where we were making deliveries out of our car, but when the AIDS crisis happened, the latex gloves was where the supply chain went down, because that was a bloodborne disease rather than an airborne, because everybody's wearing the masks here. And my dad found a whole container load of latex gloves. We'd go down in the U-Haul, put them all into the U-Haul, and him and I would deliver them down to the Harrisburg Hospital and the Lancaster General and help them out. And it was a nice feeling. So now we're back here again with another pandemic, unfortunately. I'd also like to introduce Kurt Amig. He's the president of our company. And Nick Amig, the vice president of our company. They are a dynamic duo. I'm very blessed to have them. My father always told me when starting a company, always surround yourself with successful and good people, and these guys really are. They take my vision and they put steroids on it and do their own thing too sometimes, and before you know it, it's done, and it's done better. So I'm very blessed to have them on board at Americhem. And also I want to introduce the staff at Americhem. They're also wonderful people. I could never ask for a better staff in my life. These guys work tremendously long hours through this crisis. They've worked weekends, they worked nights. They did what they had to do through this crisis, and there was a tremendous amount of business going through Americhem, more than doubled the business of Americhem overnight when this happened. So Governor Wolf, Director Collins, PEMA Director Padfield, this is my team, and as a team, we'd like to thank you for visiting today and tell you that it's an honor for us to host you. Americhem is in a unique position to assist in this crisis. Remember, we're in the janitorial and sanitation field. Our customers are diverse among every vertical market, from healthcare, education, industry, hospitality, food processing, commercial cleaning, gyms, convenience stores, fire companies, police stations, local boroughs, state, federal, and I can go on and on. We have toilet tissue, paper towels, and hand soap. Everybody needs to do business with a company like ours for business to business. We have 10,000 plus SKUs, which include PPE such as disinfecting chemicals, disinfectant wipes, hand sanitizers, vinyl and latex gloves, nitrile gloves, 3-ply masks, child 3-ply masks, KN95 masks, N95 masks, adult shields and kids shields, electrical equipment such as electrostatic sprayers, 360 fogging machines from Clorox, foggers, thermal imaging systems such as you saw when you were walking in that take your temperature, tell you to put a mask on, HEPA filters and air scrubbers that we actually have them up in the Senate and the House. Maybe the governor's mansion might want some too, who knows? Maybe PEMA might want some. But we also have antibody and antigen test for when the testing begins. We're hoping that we can help a lot of these school districts and colleges open up their facilities. We also perform trainings in our facility. I believe we're one of the only companies that do something like this because we really like to partner up with our customer base and our clients. So we have a training room right in our facility here. It's a beautiful one. And we also do training on site. Obviously, with the social distancing, we haven't really been able to do anything in our training center since March. So a lot of our trainings now are virtual. Now, some of the trainings that we do are bloodborne pathogen trainings, decontamination, disinfecting, food service and clinical area cleaning, ATP testing, constant standard practicing, the chemistry of cleaning, and I can go on and on. We have 30 or 40 plus trainings that we do, and we also have a health and safety specialist. Her name's Lori Holmes. I don't know if she's here right now. There she is waving. She does a great job, so she will go out to our clients and do a lot of these trainings, many of them at no charge at all. So through Kathy Bruder at Saxton and Stump, I was recommended to talk to Director Sherry Collins, and lo and behold, she's an old high school friend of mine. So she guided me to the Pennsylvania COVID-19 portal back when this pandemic started. With all the Americam's capabilities, it was a no-brainer for us to enroll in the Pennsylvania COVID-19 portal. In the very beginning of this crisis, we were wondering how we can inform potential new customers of our PPEs. And this portal made it very easy for us because we didn't have to reach out and inform anybody, because it was tough, number one, because our account executives who are on the road are now in their house trying to do business with a lot of their clientele. But when we got on this portal, especially the first week or so, we were getting flooded with emails asking us, do we have KN95 masks? Do we have any type of masks, any type of gowns, hand sanitizer, so on and so forth, because everybody was trying to open up. And a lot of those people and our staff were here on a Saturday before Monday, the Monday where everybody needed to have masks in the office. And a lot of those customers that were on the portal and a lot of our own customers showed up here on a Saturday, and we were giving boxes and cases of 3-ply mask out to them. In this portal, I'm not sure if anybody has taken notice to it, but this portal has I'll call it a website, and it has 8 portals, one being KN95 masks, others are fabric and other masks, disposable masks, thermometers, hand sanitizer, face shields, medical gowns, and cleaning and disinfectant. Boy, it couldn't be better for a company like ours, a janitorial sanitation company. We checked all those boxes. So we certainly enjoyed working with those customers. A lot of them came in. Some we had to fit test for N95 masks, and we enjoyed working with the customer bases. In closing, Governor Wolf, Director Collins, and PEMA Director Padfield, putting this partnership between government and business together, we sincerely appreciate it. We also look forward to giving you a tour of our facility. We're very proud of it. The podium is yours, Governor. Yep, thank you.
So thank you, Mark, and it was really nice meeting Bill. Nice meeting you. Thank you for everything that you've done. I feel really at home here. My company, up until 5.5 years ago, I was running a business like you, and it was in distribution. And I know what you say is absolutely true. The first thing you have to do is make sure you surround yourself with really good people. So that's really important. You're all really important to what goes on here, and I think you know that, and it sounds like you have an owner who absolutely appreciates that. So thank you for everything that you're doing. And I want to thank, I've also surrounded myself with really good people here with Director Collins and PEMA Director Padfield, so thank you for everything that you've done. This has been a tricky year. Some folks are sort of talking about 2020 as a year that may never end, or seems like it's never going to end. At other times, it seems like things are just going too quickly. And it has been a year that's brought a lot of change and a lot of confusion and obviously a lot of hardship for so many Pennsylvanians, families, businesses. So it's easy to get caught up with the idea that this really is a moment that is not going to end, and it's sort of nothing but bad news. So I think it's important that occasionally we take time to step back and look over the last 6 months and try to maybe see what actually has happened. And it is important to actually think about the bad things that have happened, to commemorate the difficulties, the pain, the lives that have been lost, the families that have been hurt, the businesses that are struggling, and the workers who've been, all of them, pushed to their limits. But I think we also need to reflect on the things that we've learned during this time, and all of the things that we've actually accomplished. So we can evaluate all the things we could do differently if we ever have to do this again, and also prepare for the future. Because we've learned and accomplished a great deal in the 6 short months that have passed. And we're far more prepared to fight COVID-19 now than we were just 6 months ago, in no small part due to the things that people like Mark Zimmerman and his company are doing. When I announced, and it just seems like not too long ago, but it was 6 months ago, the first 2 presumptive cases of COVID-19 in Pennsylvania, that was March 6th. And there was a great deal that we really didn't know about the disease at that point, including the best ways to treat it, the best ways to prevent Pennsylvanians from contracting it. And what we did know was that we didn't have enough stuff to actually address the pandemic. But Pennsylvanians came together to fight this virus. And in the end, we're not at the end, I guess, but so far we have succeeded. Research in the University of Pittsburgh just published a study, and a couple months ago Drexel University published a study saying that what we've done as Pennsylvanians has saved thousands of lives and all over Pennsylvania. And we did this because of the resolve of Pennsylvanians. 13 million Pennsylvanians really stepped up and did some really remarkable things and made sure that Pennsylvania has done a pretty good job. We had Deborah Birx here, who's the administration's, I guess the president's personal medical assistant, and she gave us pretty high marks a couple of weeks ago in Pennsylvania. And I think she's right. But we have learned a lot, and there are a lot of things that we can do now that we couldn't have done before. We know, for example, that this is an airborne disease, and that wearing a mask actually works, that social distancing actually works, and that if we keep doing those things, regardless of what anybody does, we can keep this disease in check. These are simple things. And we know more about how we can protect frontline workers, which is where Americam comes in. We know what protective equipment can do, and we know what is needed to help keep the workers who are on our front lines safe. They put themselves at risk, whether they're in healthcare, whether they're a first responder, whether they're actually in food processing or food retail, all those things they do, they put themselves at risk for us. And this is where personal protective equipment actually makes a difference. And so that's why 6 months now after the COVID-19 broke out here in Pennsylvania, we have successfully reopened our economy. Our stores are open and our businesses are reopened. And a large part of that is because of how Pennsylvania businesses like Americam have stepped up to help. This has been a joint effort, a community effort, and all of us have really worked hard. But I really want to say, thank you to Americam. In response to our critical need, the Commonwealth's critical need for personal protective equipment in the early days of the pandemic, companies like Americam stood up and actually did some amazing things. Now, we helped them, and I think that's where the Department of Community and Economic Development came in we created online portals to say, if you're a business and you do something that's even remotely close to what we need to keep people safe in this emergency, this pandemic, here's some opportunities for you to help. And again, Americam and others stepped up. We had a staggering response actually from the business community. Manufacturers in other industries retooled their production processes to create more PPE. We had existing PPE manufacturers who increased production to get more products into the hands of people who needed them. And we had distributors, again, like American, who work closely with the Department of Community and Economic Development and other businesses across the Commonwealth to make sure that every company that needed PPE for its workers had access to it. And just think about this. This all got up and running in a really, really short time. It's pretty amazing. Americam not only provides the products, but it also, as Mark pointed out, trains customers on how best to use those products. This type of support is critical to helping Pennsylvania schools, businesses, and all kinds of organizations reopen safely. And the flexibility and ingenuity displayed by Pennsylvania's businesses, again, embodied by companies like Americam, has helped my administration secure and allocate products, the protective equipment that our folks need. I know there's been some news about states out there like Hawaii that were sort of caught flat-footed, that they hadn't spent the last 6 months building up inventory. They started off very successfully and then got a little complacent. We haven't let that happen here. And so, as Randy, I'm sure, will talk about, we have actually continued to build on our network, and we have a lot of personal protective equipment inventories that we've built up, so that if and when we get to a resurgence as we move into the fall and the weather is getting cooler, that we're going to be ready for that. But the thing is, we've learned a lot. We know now things that we didn't know before about the virus, and we know how to do things to make sure that our healthcare system, our frontline workers, are not overwhelmed by this disease. And I think that's going to be really, really important for us. And I think we should thank all the businesses and the business owners like Mark, like your company, for doing the things right here in Pennsylvania that we have needed to make sure that we're ready for whatever the next phase of this disease hands us. So with that, I want to say thank you again, and let me turn this over now to Sherry Collins, who's Executive Director of Corporate Relations at the Department of Community and Economic Development. Sherry.
Thank you, Governor.
Thank you.
Appreciate it. Good morning, everyone. First, let me thank Governor Wolf for his participation at today's event. I would also like to thank Mark Zimmerman, Mr. Zimmerman, and the entire team of Americam for hosting us today. It is critically important that we celebrate the successes that we are seeing as a result of this crisis. As the governor mentioned, there are a lot of tragedies that have come from this pandemic, but at the same time, there have been a lot of silver linings. And being able to showcase a company like Americam and the work that you all have been doing to keep Pennsylvanians safe, and even those outside of Pennsylvania, is something that you should be proud of. And we are certainly happy to be here today to celebrate your successes. The governor mentioned that the Pennsylvania Department of Community and Economic Development had developed a number of different portals early on at the start of the pandemic, one being the Critical Medical Supplies Procurement Portal. Now, I will say that DCED did not do this without the help of a multitude of individuals, including our partners at Pennsylvania Emergency Management, the Department of General Services, the Office of Administration, and an incredible team of business development professionals there who actually helped us to launch this portal in just 4 days. It was incredible. So when we talk about collaboration and we talk about spirit and innovation that is occurring across the Commonwealth, that is happening within our state agencies as well. What we have done is we have broken down those barriers and we have come together to develop these things to help our business community, to help our businesses, to help our citizens. And so I'm so glad to be here today to celebrate the successes of Americam, the work that you all have done to keep others safe, to certainly thank Governor Wolf for his guidance on the development of these portals. Without your input, Governor, and without the commitment of these other agencies and our partner organizations like the Hospital Association of Pennsylvania, the Chamber of Commerce and Business and Industry, the Ben Franklin Technology Partners, and so on and so forth, we would not be seeing the successes that we are as a result of these portals. And there could, in fact, still be a logjam, but these portals have allowed us to open those lines of communication and get the critical PPE into the hands of those that need it the most. So we are extremely proud at the Department of Community and Economic Development for the role that we played in that. Before I hand the podium over to Director Padfield, I'd like to thank him personally. You opened your doors to us, Director, and allowed our team to come into your agency safely, I might add. We had our temperatures checked every day, we were scanned, we were masked, but boy, we were treated with such dignity and respect from your crew. I know you wondered if we were ever going to leave. There are days that I think we would all like to be there, but my point in saying that is that you have an amazing team at PEMA, and they worked with us to help pull these things together and bring these systems online so that we could support companies like Americhem, and again, companies and industry and individuals all across Pennsylvania as we continue to respond to the challenges we face with COVID-19. So again, Mark and your team, Mr. Zimmerman, thank you again for participating in today's event, for hosting us, and for all the work that you do to keep us safe. Thank you so much.
Good morning, everyone. It's great to be here. Mark, it's great to hear stories of family-owned businesses that started small and grew. I came from a small family-owned business that grew over the years, and I know the trials and tribulations associated with that, but it's truly a labor of love. So I'm pleased to be here today with Governor Wolf, Sherry Collins from the Department of Community and Economic Development, and Mark Zimmerman from Americhem to discuss the strides that we've made as it pertains to the acquisition of personal protective equipment and other supplies since the beginning of the COVID-19 pandemic. At the very beginning of the pandemic, it was evident that we needed to take definitive steps to acquire, manufacture personal protective equipment, or PPE, as we could not solely rely on the existing systems to adequately supply all that we would need for such a long and complex response. Based on what we saw transpiring across the nation and the world, we knew it required us to think differently from the ways we've normally acquired equipment and supplies in the past during emergencies or other disasters. With supply chains significantly disrupted and global demands on the much needed supplies, we needed alternative strategies to meet the needs until the supply chain could recover. Under the leadership of Governor Wolf, we embarked on an aggressive strategy that included many of the components that were discussed so far today, such as the business-to-business supplier portal, the call to manufacturing portal, the business exchange, and the manufacturing process to be able to bring people and businesses that normally manufacture other goods to be able to start manufacturing personal protective equipment. And obviously the private sector and the private sector donations portal. Early acquisition of the Battelle critical care decontamination system was critical to be able to bridge the gap. We were able to work with FEMA to acquire one of those systems early on that provides for the decontamination of N95 masks and reuse of single-use masks until we were able to work the strategies to be able to resupply a lot of the critical needs. And we had to work also collaboratively with other states and surrounding states to take a look at new technologies, to be able to take a look at other suppliers, to be able to take a look at other things that were innovative, to be able to bridge the gap, to be able to meet the critical needs, especially when it comes to cleaning and disinfection and personal protective equipment. Without the combined efforts of multiple agencies such as PEMA, the Department of Health, the Department of Community and Economic Development, Department of General Services, and as Sherry indicated, Office of Administration, all working collaboratively, and a strong public-private relationships and partnerships, such as that with Americhem, We would not have been able to acquire and distribute the PPE and other critical items that we did to be able to protect our frontline healthcare workers, first responders, and other essential employees during the initial stages of this crisis. While we needed to implement strategies to preserve PPE in many locations early on in this incident, we were in a much better position than many other states of throughout the country and the world due to the early initiation of mitigation strategies that were in place by Governor Wolf and the strategic steps that we took to address the gaps in supplies and equipment that would be needed to combat this pandemic. Throughout this evolving pandemic, the needs for various supplies continued to evolve, which required us to be agile in being able to fill those gaps. This required cooperation at all levels of government and the private sector to cover the gaps, since the impact varied throughout the state, which included working with the healthcare community to load balance supplies within the existing healthcare system. Today, we continue to acquire and store personal protective equipment to be able to support a future resurgence and are in a much better position to respond to increases in COVID-19 across the state than we were in the spring because of the definitive steps that were taken early in this pandemic response. We continue to acquire personal protective equipment and other supplies and to be able to stockpile those in support of a resurgence. And it is an ongoing and evolving process for us. We're to the point right now where we've outgrown our initial location and we are looking for other locations, and we continue to be able to look for other relationships to be able to build those up, to be able to meet the needs in the future or the anticipated needs. So with that, I'd like to thank everyone and turn the podium back over to Governor Wolf to take questions.
Thank you, Randy. And now we'll all take questions, and I'll do what I usually do, which is try to pass them off to anybody else behind me here. So, any questions? Yes.
Governor, I have two questions for you on some off-topic things, if you don't mind.
Yeah.
The restaurant's going to.
So you're saying that none of these folks can help me on
Well,
any of these?
yes. Well, not yet. It's just you.
Okay.
The restaurant's going to 50% capacity today. We still have some business owners that have been questioning the data that's driving some of these decisions. Can you explain a little bit more on what's driving your decisions and how you're making them, and the message you have for these owners that are questioning this data?
Yeah, actually, businesses are open. The restrictions apply to bars, restaurants, and nightclubs, and we've gone to 50%. The original plan was to have the alcohol last call at 10 o'clock. Got some pushback on that, so we agreed to move it to 11 o'clock. The data for this really comes from a lot of different places. I mean, from surveys that look at the restaurant tabs on credit card bills. I think JP Morgan Chase has done some work there. But the real key to this was the federal government. It came from the White House task force that said this is something that actually makes a difference. And when we started to see a resurgence in areas like southwestern Pennsylvania and then southeast Pennsylvania, coming up I-95, coming in from other states, we recognized that this virus doesn't recognize state borders, and we needed to do a targeted mitigation effort to try to take care of this second. And it turns out that worked. That what we did actually did start to flatten the curve. Now we're coming into colleges and universities coming back, the cold weather coming back, flu season, so we have to be careful. But it looks like it works. So the data is that there are a bunch of different sources, but really we were driven most profoundly by what the federal government was saying. This stuff actually works. The CDC and the task force at the White House.
My other question for you was about HB 2787. That's that bill that allows districts to decide if and how many fans can be in their stadiums. By our count, it's been 10 days since the bill was presented to you. What's the status of that veto that you had promised on that?
That'll be today.
So that'll be coming today?
Yes, and the idea, first of all, schools already have the ability to decide whether they're going to do sports. As to how many fans they can have work together, I'm always amazed at politicians thinking that they can somehow wave a magic wand and suspend sort of reality. I'm waiting for somebody to come and say we're going to suspend the law of gravity. I know I keep saying that, but it's sort of the same thing. School districts, they're going to do what they do, but there's a virus out there, and that virus really likes it when you bring a lot of people together. That's what we know. And so you ignore that at your peril. Yeah, you could ignore reality, but that reality really is that the virus is out to get us. And as much as I hate that fact, as much as I'm sure, Mark, you hate that fact, everybody hates that fact, it's a fact. And instead of ignoring it, we ought to try to figure out what we do to keep that virus from infecting too many people. So apparently the folks who voted for this decided they just wanted to ignore that reality. I can't, and I don't think Pennsylvanians can afford to ignore that reality, so I'm going to veto it.
A few questions from Dennis Owens at ABC 27.
Okay, I'll pass on that.
Yeah, I have a couple.
Okay.
Last week's federal judge ruling against your mitigation efforts, has it changed your approach in any way?
No. And again, it's just what I'm sorry. Tell me your name again.
John Erickson, ABC 27. Oh, sorry.
What's your name again?
Jamie?
Jamie, right.
Yeah.
What I've said to Jamie is still true, and I think, and I again didn't understand the court ruling, that you're sort of ignoring the virus. I mean, that's the reality that we all have to deal with. I hate it. I'm sure everybody hates it, but it is a reality, and what we need to do is try to figure out how to keep people from getting sick, and that's why I don't think that ruling makes any sense.
How did PA Supreme Court ruling on elections change negotiations with the legislature on that topic? Jake Corman told us last week that it, quote, blew up negotiation.
Yeah, it didn't help. So we'll see if we get back. There are a couple things. I think it was a New York Post article a couple weeks ago, that also didn't help the negotiation. I think there's a real interest in having a conversation and continuing the conversation. So I hope that might take a pause as a result of the court decision, but that we can get back to talking.
And lastly, Pennsylvania unemployment rate remains 2 points above the national average. Why is that?
Yeah, that's a great question, and it's actually in some areas that are of real concern. Manufacturing, Pennsylvania is tied a little more to the export business and also generally to manufacturing. So when manufacturing weakens, which it did earlier than the rest of the country, we were above, even when unemployment was really at historic lows, we were still above the national average. So I think it's because of the mix in Pennsylvania. It also, be careful about that particular statistic. The more people who are actively looking for jobs, the higher the rate is. In some areas, the lowest unemployment rates in the country are places where people basically have just given up or left. So to a certain extent, you can look at this and say, at least I was looking at it, that there was sort of a glass half full, that there were a lot of people who actually thought there was a fighting chance of getting a job in Pennsylvania, which is a good thing. Yes.
Good morning, Governor.
Morning.
With the nationally recognized team that you've put together and the response to COVID-19, have you or members of your cabinet or administration been approached by either the Biden-Harris or Trump-Pence tickets to serve in a capacity in the next administration?
I haven't. I would bet I have put together. I'm just like Mark. I understand that the secret to success in anything is to surround yourself with really good people, which I have, and I would be very, very shocked if. I think it's a little early at this point, and I doubt that too many people have actually been asked if they want to be part of the administration. But I would be very surprised if somebody from the new administration, if Biden wins, doesn't come to a bunch of people in my administration and say, how about coming to Washington?
And then where do you stand on the hospitalizations being at roughly above or below 400, which is one of the lowest points since the pandemic began?
Yeah, that's all hopeful, and I think that's the kind of thing that we need to recognize, that the crude, broad brush things we had to do to buy time back in March and April, we don't have to do right now, and we can do things like wearing masks and on nice days hold events like this outside. Those are the kinds of things that actually make that hospitalization rate go down. I think we also are in pretty good shape when it comes to the positivity rate on our tests. We're working to build up our testing capacity, and we'll continue to do that. And as I say, we have some specific concerns with institutions of higher education, with colleges and universities getting. Apparently, students do today what they did when I was in college. They go to parties. Who knew? So we have to make sure that we're doing everything we can to keep our students safe. All right. Anything else? Thanks very much. Appreciate it. For family businesses that are struggling, and workers who've been all pushed to their limits. But I think we also need to reflect on the.
That's an awesome photo. Everybody looking this way. Here we go. 1, 2, 3. I would ask you this one.
Apparently, students do today what they did when I was in college. They go to parties. Who knew? So we have to make sure that we're doing everything we can to keep our students safe.
We handle a lot of shots up there. I think. Yeah. This is where some of our area is stocked. We have our Middletown branch. We have our Harrisburg branches, which is pretty large too. We keep a lot of overflow in it.
We had somebody at soccer this time.
We had back orders on that, $500,000 in back orders just on 360s, and then at the same time, I had to return all their old ones, so they had, yeah, so it was just a double whammy for Clorox. Yeah, we purchased a company up there called 501. There's a top strip on the carpet.
This flips down.
Yes, yes, sir.
Sure. Yeah.
Yeah, we have 3 techs that work full time in the shop that go around to customers and fix the machines.
So you
repair.
go out.
Oh, yeah.
Yeah.
Oh, yeah.
They're on the road a lot.
Ollie's too, we're doing all their services. They put our chemicals up in each one. We make sure that they have an N-rated disinfectant for each store. And then they use our tenant equipment, and then we service their equipment throughout route training, restroom training, whatever it is, we do hands-on training. But we also have other trainings in here that are sort of an N-rated disinfectant, fog down rooms. Hypochlorous is the best, just so you know. You probably know that. Okay. It's what they use in swimming pools. So it's safe. You don't need PPEs.
Oh, really?
And it actually it kills.
Actually, this was just an addition. This Suite 200 was 2 years ago, and just recently moved again into the last suite. And we're pushing out a little bit, but yeah, we have some other stores.